talking about the post-COVID period in patients who have recovered from COVID infection. So COVID infection may have been either treated at home if it is mild, or at specialized center if it is moderate to severe cases. Irrespective of the severity of COVID infection, what we are observing is that the risk of cardiac events exists in both the group of patients. Although the severity might vary, both the mild cases, asymptomatic cases, and moderate cases, we are observing risk of cardiac events in such patients. Therefore, especially if they're pre-existing cardiac patients, they need to take adequate precautions. So, why does this happen? When coronavirus infects the body, the heart might be affected by two phenomena. For instance, first phenomena is the body inflammatory response to the virus can cause collateral damage to the heart muscle itself. Then the second phenomena is the same inflammatory response can even affect the small blood pipes and lead to clot formation, ultimately blocking the blood supply and leading to heart damage. So by these two phenomena, we can have three different situations, and these situations can come either during the infection or after the infection. So the first situation is when the blood pipes to the major organs can get blocked. Like for instance, if the blood pipe to the heart gets blocked, it's a heart attack. To the brain, it causes stroke. To the lungs, it causes pulmonary embolism. Second situation is direct weakening or damage of the heart muscle can cause decreased pumping and heart failure. And the third instance is when there can be heart rate disturbances, that is electrical conduction disturbance within the heart, which could either lead to a slow heart rate or a irregularly fast heart rate causing palpitations, which can sometimes even prove to be fatal. So these are the three situations which can happen to your body when you get infected with COVID. So for these three situations, we can have multiple symptoms, like for instance, severe fatigue, breathlessness, chest discomfort, and palpitations. These are the common symptoms observed in such patients. But the problem here is that most of these symptoms could also be a part of the normal COVID recovery phase. Hence, what is important here is to spread the awareness, especially among the heart patients who have recovered from COVID infection. We need to spread some awareness regarding how to differentiate these symptoms which could be a part of COVID recovery from cardiac symptoms. Like for example, fast heart rate, which is one of the symptoms even observed during post-COVID recovery. This fast heart rate can be either due to fever or dehydration due to recovery, which might require just a little bit of extra good amount of fluid intake. But what needs to be known is the features of fast heart rate, which could point out towards a cardiac cause. That is more important. So when a fast heart rate is very fast and irregular, or if it is associated with giddiness, loss of consciousness, chest discomfort, and there is a very uncomfortable awareness of your own heartbeat, in such instances, it is more likely to be a cardiac cause of irregular heartbeat and has to be reported to the hospital immediately, because many of these fast irregular heartbeats sometimes can even prove to be fatal for the patients. The second symptom which we commonly observe is breathlessness. This is one of the most common symptoms which can be observed in post-COVID recovery, because it could be a part of the lung damage which happened during the COVID infection. So, but then the features which help you to realize that it could be a cardiac cause of breathlessness is if the breathlessness increases on lying down flat, or if it is accompanied by fatigue and ankle swelling. That is important. Ankle swelling could be a feature of heart failure. Or if this breathlessness, typically it increases with exertion and relieves with rest. Such breathlessness could be a cardiac cause, wherein there could be some underlying heart failure, and for which it has to be reported to the cardiologist immediately, and an ECG and echo needs to be done for such patients. Then we have the chest pain. A vague left-sided or right-sided chest pain could be a common symptom in post-COVID recovery. But what points it out towards a cardiac cause is if it is a central chest pain, squeezing chest pain, increases on exertion, relieved with rest, or if it is associated with severe sweating, lightheadedness, or even loss of consciousness. So these are all the possible symptoms which you need to be aware of. And ultimately, if you want to avoid all these situations, the post-COVID cardiac care becomes very important. So for a person who is just recovered from COVID infection, the first week of after recovery, he needs very good rest, sleep, and balanced nutrition, along with which we need a positive mindset as well. Because during the infection phase of COVID, they must have spent a lot of sleepless nights or irregular sleep during the daytime and nighttime, and poor nutrition due to decreased appetite. So the first factor, even before starting off any of the aerobic activities, is good rest, good sleep, and balanced nutrition, along with a positive mindset. Another important point is for pre-existing cardiac disease patients, they need to make sure that they continue their old medicines timely. None of the medicines should be skipped. And another point is for patients who are at risk of sudden clotting, like for instance, there is a blood test called the D-dimer test, which is done. If the D-dimer level during the infection was high, if the CT severity score of the patient during the acute infection was high, or if the patient has any severe cardiac risk factors like very uncontrolled diabetes or previous history of stroke or such patients, they might need to be on certain anticoagulants or blood thinners. But definitely it is as per the consultation with the cardiologist. There should be no self-prescription of these blood thinners. Then after maintaining all this, you need to have a slow and gradual initiation of aerobic activities. Like for instance, you plan out a program of at least 45 minutes of aerobic activities per day. But how the program should be is that there should always be a warm-up session before exercise and a cool-down session after exercise, which should be for a period of 5 minutes each. Then you need to drink plenty of water, avoid exercising in very hot weather, and also avoid exercising immediately after a meal. You need to wait at least for a period of 1 hour after every meal. And try as much as possible to wear some loose, comfortable clothing and supportive shoes. So then in the initial phase, when you start off with the warm-up should last around 5 minutes. What a warm-up does to your body is that it prepares your body for the exercise so that it might prevent sudden muscle injury or some amount of spasm, which can happen if you do a sudden activity. So that is why warm-up becomes important. These warm-up exercises can be done even in a sitting or in standing position, and they should involve usually some amount of stretching, like a shoulder shrug or a shoulder raises, or any amount of mild activity which might make you mildly breathless. Then after this, such movements can even be repeated 2 to 4 times. So after this warm-up comes the actual fitness exercise. So your initial phase, we definitely avoid the bodybuilding exercise, at least for a period of 6 to 8 weeks. We prefer fitness exercises. So after 5 minutes of warm-up, you need to have at least 20 to 30 minutes of fitness exercises, and which should be there at least around 5 days per week. So what are these exercises? Any activity that will make you feel moderately or even mild to moderately breathless can be counted towards your fitness exercise. Like marching on the spot, just standing in one spot and just marching, that could be one of the fitness exercise. Step up, when you have one step and climb up and down of that one step, that could also be a good fitness exercise. Walking on flat ground or walking on a slight uphill area, these are all examples of fitness exercise. But never try to reach your pre-COVID level of activity. Always go gradually and slowly. It might take some time to reach that level, and you need to have some amount of patience. So once you're done with this fitness exercises for around half an hour, you need to start off with the cool down exercises. So what this cool down exercise does to you is that it allows your body to come back to normal even before you stop the exercise. So this should last at least around 5 minutes. And by the end of this cool down exercise, your breathing should be back to almost to the normal. And some of the cool down exercises could be very similar to what we do in the warm-up exercises also. So these set of aerobic activities should be continued regularly and gradually increased so as to reach the pre-COVID level of exercising by around 6 to 8 weeks. But what you need to watch out for is If any of the symptoms like lightheadedness, giddiness, loss of consciousness, chest tightness, heaviness, excessive sweating, breathlessness, if any of such symptoms are observed, immediately stop exercising and report to the nearest cardiologist. And irrespective of having the symptoms or not, ideally, any patient who was a pre-existing cardiac patient and was affected with COVID, or any COVID-affected patients who had definite cardiac risk factors like diabetes or family history of cardiac events, such patients are always advised to have at least one cardio consultation with ECG and echo during this period of 6 to 8 weeks post the COVID recovery. So these are some of the very simple and effective ways by which we can gradually come back to our normalcy. And little bit of precaution and little bit of patience, I think, makes a lot of difference to such patients. And by the end of it, we will be able to definitely get back to our normal pre-COVID level of activity. So these are some of the